So let me just start out by saying my name's Adrienne Lobby, and I'm one of the co-founders of Homeless Action. And we set this up because this is a process that's happening kind of inside a governmental homeless service provider network that for a lot of people is pretty opaque. It's difficult to understand what's going on. And anyway, there has been some stuff that's gone on. There was a organization called the Leadership Council, which was in charge of a certain amount of homeless funding and a fairly large amount, and also setting policy for homeless services in the Sonoma County. But it turned out that group was set up incorrectly according to HUD guidelines. And so they got an attorney involved, and their attorney said, no, this is just, you're not doing it right. So they had to sort of reset and start all over. And they went back to the prior organization, which was called the Continuum of Care. And they looked at 2 years ago when the Leadership Council was set up, who was part of the Continuum of Care. And they said, okay, these people are now Continuum of Care members. Those people are going to vote for the Continuum of Care board. And that board will be the one to make these policy and financial decisions. So that brings us here today because we've had a couple months to work on this. And there's certain seats that are elected and there are certain seats that are appointed. 7 seats have already been appointed and they're taken care of. But the 8 seats that are being elected are going to be voted on tomorrow at between 2:30 and 5:30. There'll be a Continuum of Care membership meeting. And the 32 people who have been approved for voting will vote on the candidates. So Homeless Action, we have 2 reasons for doing this. One is to spread information about the value of the Continuum of Care board, the difficulties that they face, what are the issues generally in the homeless community and in the homeless system of care. We want to just get all of us more educated on all of this kinds of issues. And we also wanted the voters, these 32 people, to get more familiar with the candidates because we got the names of the candidates on Friday night. And there's no other information except their name and their basic organizational affiliation. So we wanted people to have a chance to meet the candidates, get to know them a little bit, and think about it before tomorrow afternoon when you have to vote. That's the purpose of this meeting. For those of you who are candidates tomorrow, you do have another chance to address the meeting. It's not clear if they're going to give you a 3-minute time or less, but you will at least have a chance to make another statement. And that's at 2:30. If anyone here has trouble knowing where that meeting is or needs that Zoom, please just ask in the chat. We will give it to you. I want to thank people from Homeless Action who encouraged us to do this and supported us, including Teddy Pierce, who's here today. And Teddy's going to be helping us with the chat and the Facebook comments if there are any. So what we're going to do is I'm going to go down so if everybody would just mute if you're not speaking at the moment. That's just basically to keep the background noise down. And I'm looking at my list to see. It looks like the first person, and I did not organize this by seats. So please, when you introduce yourself, tell us which seat you're in or you're running for. And one thing, if you can get it in, one thing you would like people to know sort of educationally about this whole process, as well as, of course, who you are and all that. So I think the first person we have here is Alice Lynn.
Hello, everyone, and hello, Adrienne. First of all, I would really like to thank Adrienne Lobby and Teddy Pierce for your organizing this event, and Teddy for creating a spreadsheet of our basically our candidate statements. And you are showing a level of leadership that we have really needed in this community in terms of transparency and public participation. So thank you very much. Okay, so do you want us to go through the 4 items, Adrian?
I think this is your 3 minutes, Alice. I gave you some suggested questions, but you use them the way you want.
All right, thank you. Well, I'm a person with lived experience of homelessness. I've been housed now for about 4 years. I was homeless in Sonoma County for about 3.5 years. About 2 of those in shelters. It was either about 6 shelters, including the living room, day shelter, when Celeste was there. And let's see. I was on the technical advisory committee and wanted to be on that committee because I was deeply concerned about system design and physical design of the shelter system that was creating numerous barriers to people getting out of homelessness, which was a waste of resources and a waste of human beings' lives. And on top of that, I'm just going to start being honest about this, because there's never been a space to be honest about this. People in the shelters are getting abused. And it's not just coming from the low-level staff, it's coming from the administrators. And there are system problems that need to be addressed so that this can't happen. And I want to collaborate with those providers to ensure better systems so that this can't happen. I have a list of about 11 proposals for system design improvements that would save money and improve people's lives who are in the shelters. However, even though I didn't have lived experience of being unsheltered, except for 2 weeks of staying in my car at one point, I felt that my responsibility in the TAC was to speak for the unsheltered, who are in by far the most serious circumstances. And the system of care seems to have a lack of triage for whose needs need to be addressed the most, which of course is people who are living outside or in cars. And yet
that's your 3 minutes.
Okay.
I'm going to try to give you 30-second. I'll just say 30 seconds for people. And I'm sorry, Alice, I didn't have that system set up for you. Thank you. That was very eloquent.
Adrian?
Yes.
Since Alice didn't know that when she started, and I would ask maybe if we would allow her to make one final summary statement, because she may not have gotten to the place.
Yeah, go ahead.
Thank you very much, Gail and Adrian. I want to advocate for a formalized agreement that just as the United Nations has adopted a minimum standard of care for the treatment of refugees, including fenced camps, security, hygiene, and so forth, we need to have a minimum standard of care for the treatment of homeless people in our county. And I'll leave it at that for the moment. Thank you so much.
Thank you. That's great. Ben Leroy, you're next.
Oh, thank you so much. And thank you to Adrian and Teddy and everyone from Homeless Action for putting this on. I think it's great to have this forum to be able to get to know the candidates and just for people who really care deeply about this issue to have a place to come together on a Sunday. So my name is Ben Leroy. I'm the Special Population Programs Director at Santa Rosa Community Health. And as part of my job, part of my duties are to direct our healthcare for the homeless operations and policy and partnerships. So we are a fairly qualified health center. And as part of that, we do receive specific healthcare for the homeless funding from HRSA, which is the federal government organization that is in charge of overseeing fairly qualified health centers. And so in 2018, I took this position and in that time was able to help Santa Rosa Community Health launch our mobile health services. So we're able to now bring some of those health services to homeless people where they are congregating in shelters and other locations, such as the FEMA-funded non-congregate shelter sites for COVID-19. We've been going out to Los Guillicos, Sam Jones Hall, to the Sonoma State campus when the non-congregate shelter site was there, now up to Alliance Redwoods and the fairgrounds, as they have some of the non-congregate shelter sites up there. And my experience before Centers of Community Health is I worked for 10 years in healthcare for the homeless and permanent supportive housing provider in San Rafael and Marin County. And in that position, I actually served on the Marin Continuum of Care Board for about 4 years as one of Ritter Center's representatives. And in 2017, I helped launch Marin County's Whole Person Care Program and our coordinated entry system for permanent supportive housing and rapid rehousing. And so I have a good amount of experience launching programs that both help both health and housing and homeless services, and ones that follow the principles of housing first and harm reduction. And in helping with the Whole Person Care launch, integrated services. So actually bringing integrated health services to people experiencing homelessness, either in shelters or in permanent supportive housing. And that's something that I'm really passionate about. And I think that healthcare organizations in general can bring a lot to the table in discussing these policy issues, but also as we prioritize people through coordinated entry here in Sonoma County for shelter, but also for permanent supportive housing placements. And those are some of the things I'm really passionate about. And as we go through, the pandemic, one of my top priorities for the next 6 months is just to continue ensuring that people experiencing homelessness are well protected from the pandemic, and that people who are living and working, 30 seconds, thank you, in congregate shelter sites are going to be prioritized, hopefully, to get vaccines. And that's something that we need to be advocating for, to make sure we all know that healthcare workers and people living in senior centers and those type of congregate living shelters are now the top priority. And then we need to really work on who's going to be the second priority. And I think people living in congregate settings and working in congregate settings need to be at the top of that list.
Perfect. Thank you.
Thank you.
So of the people who spoke, Alice Lynn is running for the community advocate seat, and Ben is one of our at-large candidates. Chris Keys, also at-large candidate, and after you will be Don Schwartz. Chris, you ready?
Hello? There we go. Okay. You hear me?
Yep.
Gotcha.
Okay. Thank you, Teddy. Thank you, Adrian, and all of Homeless Action for putting this on. Such a great thing. I was wondering for the last week how the people are going to get to know us. So such a great thing that you're doing. My name is Chris Keys. I'm the director of Shelter and Recovery at the Redwood Gospel Mission. I've been there for about 13 years, and the director of Shelter and Recovery for about 9. We have historically have not been part of the CoC, very involved. We've been around, we've been in and out of meetings, but it's our desire to partner with the community, the city, the county, and other homeless services. We think it's time. We think it's time to bridge the gap. That's my goal. That's been my goal for the last few years, is to bridge the faith-based community to the CoC so that we could all work together in unity. I went to the Redwood Gospel Mission off the streets, actually. I was in jail and came in, and I had like 13 and a half years ago, walked into the program, graduated, they hired me, and I worked my way through the ranks. And now I get the opportunity to lead the ministry, and have been involved in a lot of the innovative things that you've seen in the last couple of years, things like authoring the nomadic shelter, the mobile showers, the Black Hill catering program, things like that. So I'm highly motivated for like-minded people, stakeholders in the community, and this is a great opportunity. I was part of the TAC also, and I applied for the TAC because of this very reason. I wanted to help bridge the gap. There's over 160 churches in the county, which equates to about somewhere near 15,000 people who are willing and able to help, and we can tap into that together. It's been years since the Rebel Gospel Mission has been at the table, and I'm excited. I think we can offer a perspective that's new, and I think that we can learn from everybody else. And so we're just excited at the opportunity to be at the table. Regardless of how it turns out, we will continue to try to partner with everybody so that we can move forward. It came to the light really to us this year, especially after the 2017 fires. Personally, as affected, I lost my own home, but as an organization, we saw the need. The need was to unite. There's no one entity that can resolve homelessness alone, and so it became very obvious to us. And we did a little test this year when we were out at the Alliance Redwood camp, and the county came in after, and we decided to stay out there. And we currently are working with the county and Alliance Redwoods out there with the NCS, and it's going great. And so we're excited about possible opportunities. We're excited about new partnerships and new relationships. We're about transformation, and that's what we want to bring to the table.
Time, Chris. I don't know if you heard me say 30, so let me give you a chance to complete your thoughts.
Oh, that's okay. I would just say that we're excited to be here. We're grateful to be part of this, and whatever way we can help, we're here to do that. No hidden agendas, no proselytizing to you. We're not going to hit you over the head with the Bible. We're just here to be part of the mix.
Is he at large?
Yes.
Yeah, thank you. Don, you're next, and then Eddie Campagnola, I don't think is here, but if not, then it'll be Gail. So go ahead, Don, and tell us a little. Yeah, go ahead, Don. You're muted still.
There we go. So I'd like to add my thanks to you and Teddy for organizing this. Appreciate it. My name's Don Schwartz. My day job is Assistant City Manager for Roanoke Park. I've also been on the Leadership Council for, well, till it disintegrated a couple of months ago as the representative from the small and medium-sized cities, and I'm a candidate for an at-large seat nominated by the 9 cities. And it was 2 years ago this week that the Leadership Council met for the first time, and yet here we are still talking about governance. We really haven't had any meaningful discussions about strategy or about using data to drive decisions or about building capacity in the system that we have here in Sonoma County. It feels like we've made steady progress backwards, to be honest. And we've also had little to no input from local experts, those with lived experience, other than the couple that have been on the board, as well as public comments. Very little from providers, from faith-based community, healthcare. It's really felt like we've been separated from people who bring a lot of expertise to the table. So why do the cities want to be involved in this? Stephen Covey has a line. I'm a big Stephen Covey fan. It says, "No involvement, no commitment." We want to be involved, and that means broader representation and included in the decision making. And the commitment would come where we're seriously considering funding the countywide system, but that's going to require some city representation more than exists now. Without some kind of representation, it's highly unlikely there'll be funding put into the regional system. Spoke to one council member yesterday on that, for example. Why me? 2 years ago, the medium and small cities weren't involved. And I think since then, I've been able to prove I can get them to the table. They believe I can be effective in helping to restructure a broken system endorsed by all 9 cities. I have a county background. I oversaw the budgets for CDC and the health department not too many years ago, and so familiar with the ways of the county. I believe we need to build capacity and use data. I teach at Sonoma State, and those are some of the things that I cover. And we need local subject matter experts deeply involved. The value and the voices not heard from. We need to hear from them. The city's agenda, and we do want to see substantial progress by the end of March. We're tired of waiting around for this. We want to see a restructured board, a system with a meaningful role for us as well as for the experts. We want to explore and pursue a new lead agency sooner rather than later. We want an action-oriented strategic plan that includes building capacity and using data for decisions. Thank you.
Thank you. And I still don't see Eddie. We did get a response from Annie Nicole, who's taking a family day today, and I will post some of the information she sent us into the chat. So hopefully you'll take a minute and read that. The next person is Gail Brannell.
Good afternoon, and thank you for inviting us here today. I have been involved with homelessness since it's been an issue in Sonoma County. I was involved in the first homeless count and have been involved in every homeless count until this year. I have worked for the city of Santa Rosa for 20 years in housing and homeless programs, including grant administration. I was on the Sonoma County Task Force for the Homeless, working to advocate for homeless services, including a stint as chair. I have been a member of the Continuum of Care since the very beginning, and I also served on the evaluation committee for many years, as well as a couple of stints as the chairman of that. I have served on the Continuum of Care board as the advocacy person representing the task force. That organization is no longer there, so I am no longer seeking the advocacy seat that is in error in the listing that was put out. I am seeking an at-large seat. My expertise, as you can hear, is pretty much in the area of program and policy. I have been involved not so much in the trenches with people directly, except for my own personal relationships with homeless people in Santa Rosa when I worked in Santa Rosa and here in Sebastopol. I have long gathered food, clothing, and camping gear for people when I was out and active, not kept home by COVID. I have quite a number of ideas about what needs to be done from being involved for a long time in the system. I think it's really important also to have people who have the lived experience of homelessness and who are willing to talk about what changes are needed, who are willing to bring forth their ideas about specifics of changes that need to be made. Indeed, one of my primary hopes for the reformatted Continuum of Care is the idea of a big tent where we have a geographic diversity, where we have a demographic diversity, where we have diversity of different kinds of services that are being offered. What was that?
30 seconds.
Okay. I would also like to evaluate the Continuum of Care collaborative applicant, HMIS, and coordinated entry. I'd like to work with Continuum of Care programs for efficiencies and effectiveness. I'd like to find areas of common vision to work on early to build trust and then to work on harder issues. I'd like to help by representing Sebastopol and the West County. I've been nominated by 3 different entities. And so I hope you'll vote for me for member at large.
Thank you very much, Gail. The next person is Gregory, and then I see that Eddie is here, so we're going to go backwards a little bit in the alphabetical list. And Eddie, we are doing 3 minutes from each. We'll start with Gregory, and then you'll have your 3 minutes. Howdy. All right, Gregory, you're up.
Okay, thank you. I appreciate, again, Teddy and Adrian. I'm pleased that you, more than anything else, have brought us all together because it, as we said often, it takes a village to do anything big, and this is one of the biggest things and most impactful things that all of us have been a part of. I'm also pleased that most of the things people are saying seem to be in agreement with moving forward effectively My background, first of all, I'm running for 2 seats. Let me just make sure everyone's clear. I chose to go for both the funder position and the at-large. As all of you, I had no idea who was going to be running, and I basically said, oh, what am I qualified for and what should I try for? All of the voters have 8 votes. So running for the at-large and the funder doesn't conflict. Yeah, I'd love to be one or the other. I'm trying to just provide my expertise and history. I've been on boards of directors of nonprofits and philanthropic organizations since I was 12 years old. I have 60 years of trying to help everybody on my board, in my circle, agree on things. Deciding things are the hardest things for boards to do. We all bring expertise, we all bring passion, we all have interests, but we all don't know, usually, how to operate on a board, how to get decisions made, how to make compromises, how to figure out ways of using staff. One of my other hopes is that we will improve the capability of this board to use its staff well. We aren't served very well by this board, in my opinion. This board has too little resources, too little direction, and too little ambition to help this board make those kinds of decisions. It's much more of a sort of top down than bottom up. It's much more of a we'll tell you and you'll have to do. I'd like to see that change. I'd also like to, as Don said, I'd like to see some real data that shows what it is we've been funding and how well it works. I'd like to see some goals about what we're trying to do. There's a lot in the field of homeless housing. I've been in it all my life. You can do anything well if you figure out what it is you want to accomplish. In the philanthropic world, I'm one of those gurus that has been pushing impact evaluations, outcomes. That's never been brought to this kind of a board. And I'm worried that it won't, unless there's some passionate people with expertise who have the sort of diligence and the
30 seconds.
and the ability to work within a board. I think that's my strongest strength. I've been doing it sort of from the outside on this board, but I think I have something to offer. These shoes have some more tread on it, and even at 73, I can help.
Thank you very much. All right, Eddie, are you ready? Eddie is running for the lived experience seat. Begin.
Right. Yeah. And that speaks for itself. So, I mean, I have 7 years of living or surviving, I should say, on the street without shelter. And that's all there is to it, you know? So I hope that people will listen, and I hope I get an opportunity to share whatever experience I can to make things happen better. That's all. Thank you. And thank you, by the way, for nominating me, you know, and you know, I'm humbled by it, and I you know, thank you. I'll do a good job.
Thank you. That's all we ask, I believe, from anyone here. Next person I have is Catherine Yorick, and after that, Ludmilla. Ludmilla? Is that how you say your name? Would you say your name for me, please? Ludmilla.
I'm working on it.
Yeah.
Hi, yes, I'm Ludmilla, Luda for short.
Okay, thank you. So you're up after Catherine, and Catherine is running for the homeless advocacy seat. Go ahead, Catherine, when you're ready.
Okay. Hello. Thank you for putting this meeting together, and it's pretty wonderful to see so many people here. I am an advocate from the community. I've been involved since I retired from teaching kindergarten about 5 years ago. I have done a lot of work directly on the streets with people, bringing food, clothing, helping with different conundrums. Worked really hard with the registration of the vehicles out at Challenger Way back a couple years ago. And one of the things that I find that I bring to this board is that I have a lot of contact with people who live on the street that won't talk to officials. And I have people who call me and talk to me and bring their ideas. In fact, I tried to nominate a couple of people, and was told, you got to be kidding. No one's ever going to listen to anything that I have to say. And so I want to be the voice for those people who maybe are transgender and don't want to show up, people who have other difficulties that also don't want to show up. I want to congratulate Eddie for being on this board, because his book, Diving in the Dumpster, is a local book, and you might want to take a look at that. I think he brings a lot to the table, and he also can speak for people I can't speak for, even with my friendships with people. I was on the TAC. I visited all the HUD programs in our area and helped evaluate them for funding when I was on that committee. When I'm on a committee or a board, I'm dedicated to doing the work and reading the information and learning and finding how to use data. And I don't appreciate being asked to just take some information that comes from a staff and stamp it. I'd like to see that this group is thoughtful in their processes and is thoughtful in their reading and is dedicated to doing their homework, and not like the advertisement said, you know, you only have to go to this many meetings a year. It's not just this many meetings. It's a lot of other work too. So I hope everyone is prepared to do that kind of work. And I've talked about it with my family, and I'm committed, I'm ready. Thank you.
Thank you. All right, Ludmilla.
Well, hello, and thank you everybody for welcoming me to, to have a seat here, at least for a minute. And I have, I'm going for the lived experience seat. I am new to this. I have a couple of years of experience on the streets. I in a small trailer tiny home, and I am a very active, hands-on, connecting kind of person. I would really like to meet with people in the homeless community and see and just talk with them and really kind of see what, how they're feeling about what is needed and what is happening. And my first job really is to see what is happening and to understand the process more, because I am new to this. So I'm not going to say I'm proposing some change until I understand what's actually already happening. I am a compassionate person. I'm logical, I'm literate, and I'm very patient with people from a wide variety of experience and spectra. I really enjoy hearing people who think differently, who have different perspectives on things, as well as those who are kind of stable, right down the middle, kind of have a an established plan for getting things done. I'm over 65 myself, and I personally have a lot of, a certain amount of lived experience with overcoming abuse that unfortunately happened in my life, and kind of financial crisis. My home was foreclosed on at one point, and a number of years ago. And I personally have experienced some social shunning because of being perceived to be different in some way. And so for me to overcome those, I really have a lot of empathy for other people who are experiencing or might be experiencing that kind of thing. And I can really take the patience to connect with those people. As a board member, I would really want to collaborate toward win-win solutions between all the stakeholders, and really take the opportunity to learn more about what is important to people and how can that be effectively accomplished. Thank you so much.
Thank you. Let me just take a second here to thank you and anyone who's here with lived experience. It takes some courage to come out in the public realm and label yourself in that way and let us know some of the problems of your life. And I just appreciate all of you for showing up. Next, we have Margaret Slake and then Richard McKinney. Are you here, Margaret? There we are.
Hello, I'm here. Hi. Thank you very much for giving me this opportunity. I have 10 years of human and health services experience, and I'm the current executive director for Reach for Home. I'm energized by what I've seen and from what I'm hearing from everybody else in this meeting, and excited that I might get to be an even bigger part of a solution. I think that in order to advocate, not only do you have to understand through lived experience and from getting to know what the homeless population is currently facing, but I also think, to Dawn's point earlier, you have to know the data and the statistics, and you have to know what levers we can pull and the best practices to know when and how to pull each of those levers. And I think in order to advocate, you have to be able to effectively make the change that needs to happen to end homelessness. I think that I bring collaboration, I bring strategy, I bring a fresh set of perspectives. I think that the most important thing right now is for all of us, whoever gets nominated for the Continuum of Care Board needs to come together and collaborate and set egos aside. And we need to just figure this out without worrying about what position or level each of us is in. That's the only way that we're going to effectively make a change that needs to happen. And that includes taking a tough look at what structures are in place at all of the levels that affect this. Sonoma County is an amazing place with amazing people, but there is not an organization right now that is the convener and collaborator to bring it all together. And I see the Continuum of Care Board as this, the convener and the collaborator to fix it. And if I am given this opportunity, I will be a strategic and collaborative part of the solution. Thank you very much.
Thank you. I appreciate you being so concise. Richard McKinney, and then we have Sandra Stoffy. And I should say that Margaret, who just spoke, is running for the community advocacy seat, and Richard is running as lived experience seat. So are you with us, Richard? You ready?
I am. I don't have the lived experience. I'm running for one of the at-large seats.
Oh, I'm so sorry.
Oh, quite all right. And I'll tell you a bit about myself. I recently moved to Sonoma after living for many years in the houseboat community in Sausalito. I am a medical doctor and formerly served as a clinician at San Francisco General Hospital, now called Zuckerberg San Francisco General. I was a full professor at UCSF. I retired in 2017 after a 40-year career, first in private practice and then in academic medicine. At San Francisco General, I worked with a largely underserved population, including a lot of homeless individuals. I've worked also at 2 different free medical clinics in the Tenderloin, the clinic at Glide Memorial Church, and also St. Anthony's Free Medical Clinic. I helped San Francisco's Office of Urban Health and Housing develop a pilot program on chronic pain for the homeless and the recently housed. And I was one of the founders of a nonprofit called Integrative Medicine for the Underserved, which is a national group focused on delivery of holistic care to the disadvantaged. I Am For Us is now thriving. It recently had its 10th national meeting. I think I would serve well on the board for a couple of reasons. As being recently retired, I have the time, and I also have a passion for social justice and for adequate housing. I have experience in working with the homeless, and experience in addressing challenging problems with very limited resources. I have expertise in addressing medical issues that are common in the homeless population. I've worked with boards in the past and in fact formed the board for the I Am For Us organization. And I have a history of working with a variety of organizations and diverse individuals. So my life work has been focused largely on serving the underserved, and I'm ready to focus on the housing crisis and the issues of the homeless. So I appreciate your support. Thank you.
Thank you. Next is Sandra Stoffy and then Stephen Sotomayor.
Hello, everyone. I'm Sandra Stoffy. I am a social worker. My experience is I have been a social worker from Lima, Peru, where I was born. I worked there 14 years as a social worker, facing complex social problems, as you know. And I came here to America 12 years ago, and I am licensed clinical social worker. I currently work as a social worker, coordinated entry in the San Francisco VA Medical Center, located in Santa Rosa. I have experience because I work with homeless with severe mental health issues that have been conservative even, and I have successful histories of recovery with them. I also create a coordinated entry system in Sonoma County. Talking about this coordinated entry system, we work as a team with different homeless programs from the VA and community providers, which have shown success. Because if we go to the point in time results from last year to this year, has been a decrease of 34%. So we have worked strongly doing a lot of standard works and community meetings every 2 weeks with all the community providers that are involved with homeless veterans. And we have been tracking and challenging all the barriers that we have. We have been doing proposals and policies and regulations. And with that said, what I will provide to the board is my expertise and knowledge as a social worker, but also as a specialist on data analysis, because I have knowledge about that. And so this is what this is applied also in the VA. So this is what I bring, and I hope that I can support to the board members in Sonoma County as right now I am supported as a board member in Mendocino County. I work also for Lake County and for Napa County. Thank you.
Thank you. Stephen, and I should say that Sandra is running for the at-large seat, and I believe Stephen is as well.
Hi, good afternoon, Stephen Sotomayor. Thank you very much for having me today. I'm really finding this forum useful, so I'm very appreciative that it was put together to be able to learn about all the candidates and be able to take a moment to share a little bit about my background and why I think I'd be a good fit for this board. Just by way of background, I'm currently the City of Healdsburg's Affordable Housing Administrator, where I've been working for the past 2 years. Prior to that, I worked for the CEO's office at the County of Los Angeles and the Los Angeles Homeless Services Authority. In Los Angeles, I worked very closely on compliance with CoC regulations for the Los Angeles Continuum of Care. Also, I created the Regional Homeless Advisory Council, which served as the CoC membership. So I've been in quite a few of the different aspects of planning for these types of boards and in the technical areas of that. I was also one of the principal authors of the City and the County of Los Angeles's homeless initiative, which led to the passage of Measure H, which was about $347 million a year for homeless programs. But, you know, while those are previous things that I held, you know, it shows that I have the technical ability to work through some of these CoC governance issues to be able to be a good representative for cities. While here in Healdsburg, I helped put together the North County homeless planning process that's been coordinated through Supervisor Gore's office, which includes Cloverdale, Windsor, and the City of Healdsburg, looking at a way that we can coordinate resources, which is something that I think the CoC board really plays an essential role in, is making sure that we have a coordinated response to the issues of homelessness. In addition, at the city of Healdsburg, in coordination with Reach for Home, we've been able to create 10 units of permanent supportive housing through existing affordable housing developments. That's a very complicated financial procedure, but it's something that I have a background in as a project manager for affordable housing development. So I think I can bring that level of skill to the board. So I've been, involved heavily in governance, heavily in planning processes, as well as executing on a day-to-day basis. But I strongly believe in collaboration and, more importantly, transparency. I think the most important thing that this board can do is to ensure that we're listening to our providers that are out there, ensuring that we hear from the people on the ground working every day with those experiencing homelessness to ensure that we represent them adequately, and also to make sure that cities have a very strong voice in how do we approach homelessness, to ensure that we have geographical equity in how funds are distributed and we don't miss certain populations, and that we have good representation in that manner. So I want to thank you very much for your time. I think that I could fit in very well and be a very useful board member for the rest of the continuum of care. Thank you.
Thank you. And I think our final talker today is Thomas Ells, who is running for 2 different seats, the lived experience seat and, an at-large seat. So Thomas, if you're ready, I'll give you 4 minutes so that you could talk about both of the things that you're involved in.
Hi. Okay. This is Thomas, and I just want to thank everybody that's been talking and introducing themselves as candidates. They bring a vast array of experience, and I would dearly like to work with any and all of them on this Continuum of Care board. As I recall, before the people who were on the Continuum of Care board before, such as Gail and the others, Tim, whether it was Dan, everybody brought a great deal of experience from their areas. And similarly, these folks do as well. And my own experiences, I went into anthropology originally going into college because I kind of looked around and I thought there were a few holes in what our society was doing, and we needed to staunch them up. And so I studied cultures all around the world about how people transition from one part of life to another. That's really what that anthropology is about at its core. And the problem with anthropology, though, is it's a group of people that are in their own heads, and there needed to be a lot more understanding of what was happening on the ground. And so from that point on, I really focused on the visceral, more understanding of the aspects of how to get from one point to the other. And so I have a very technical background in doing a lot of those things with regard to whether it's actually doing housing and development or actually doing accounting and administrative law and coordinating all those kinds of things. But I do also have a good deal of lived experience. I went through a point of life change, if you will, through a series of events that one was a major car accident, which I came out of, physically without injury, but it was a head-on collision on a freeway, and not at all to my doing or anything, and nearly avoided it, but I wasn't able to avoid it, and out of that, it was just very stunning of how short a time we're really put here. But one thing that I would add is that the homeless themselves need to have a voice that can be. Well, the main thing is even, whether it's Ian DeJong's vision or whether it was the original CoC that had the staccato kind of approach that we only have so much money and we can only do so many things, is we're not really, there's so many people that are left out of the equation. And we need to be able to have an advocate for safe parking and safe camping and these other things that are not traditional ways of going about it, but that can help so many more people, because we're helping only so few people, whether they're the most disabled or the most vulnerable, or before there was sort of this interim level of vulnerability or disability that people were being housed. And even still, there was just this veneer of people, and particularly coming forward with what's going to happen as far as potentially a lot more people being evicted coming up. We're going to have very flexible processes and be able to use the funds with great economy. And that's really the key, I think, as well as one thing that I add to all of that is a project management experience.
Oops.
I apologize to Thomas there. I was saying it was 30 seconds, but I was muted myself, so he couldn't hear me. And now I see he's muted. I don't know. Thomas, can you unmute yourself?
Oh,
You
hi.
want to say that last sentence over again, if you wouldn't mind.
Okay. One area of expertise that I sought out was project management, and there's a thing called project management professional, and it involves the documentation. For instance, with administrative law is how you actually do something, but how do you document? How do you create the roles that are necessary? How do you create charters? That's an actual professional designation. That's something that I've engaged in.
Thank you. Thank you.
Thank you.
So is there any candidate here that I have missed calling on that you haven't had a chance to speak? Okay, so I want, first of all, I want to thank all of you. I think we have a huge, amazing pool of talent and skill here. And I want to invite every single one of you who loses to come to Homeless Action and work with us. And I'm sure that other organizations here are thinking the same thing, like, oh, I can see that one. I want that guy or that woman. I do want to make one point, which is that it's fairly obvious that the majority of us are white. And while we've got some diversity in other ways, that is a real failing in this community, generally speaking. And so I encourage you to think about that as we go forward.
Adrian?
Yes.
Can I would like to just insert one observation, as I've just been so thrilled, that's my new favorite word, to watch this progress just in an hour. This is like a continuum of care meeting that we haven't had in years. And I would like people to just be really, just think about that and be cognizant about that, this kind of discussion, and just open, honest, no stress. It's been really nice to hear. So thank you, all the speakers so far.
Yeah, thank you. So what we're going to do next, and I want to apologize for those of you who are here that are not either candidates or voters. You're probably not going to get a chance to talk because we only have 30 more minutes. And I'm going to preference the people who are voters because they have a decision to make on, tomorrow. And I want them to have the most information they can have. The voters that I have on my list are Ben Leroy, Colleen Halbram Wallace, Jenny Lynn Holmes, Gail Brannell, Mary Haynes, Mary Slyak, Stephen Sotomayor, Teddy Pierce, and Tim, I think is maybe Tim Miller. Is there any other person here who is a voter? You are not a voter, Eddie, I'm sorry to say.
No, I just wanted to say something. Thank you.
I'm sorry, but I'm not going to let you speak again unless.
Teddy, this is Teddy. Can you hear me?
Yeah.
Yes, Dan.
This is Dan
Yeah.
Sherman. I think I'm a voter.
Okay.
Oh, good.
Great.
Oh, thanks for bringing that up, Dan.
Yeah. So again, I'm going to call on
This
you.
is Elise from Petaluma People Services Center. I believe I'm a voter
Are
also.
you a voter? Good.
Okay, great. So we've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 voters. If each of you ask one question for 30 seconds, we're still going to, it's going to be tight to get this in. So I think what I'd like to do is I'll take you one by one and ask your one question. And then I'm going to take like 3 hands from the candidates to answer. And I want all of you to try to answer in like 1 minute, because let's just try to do this real popcorny and try to get a lot of information exchange happening quickly. Does that seem okay? If anyone?
Yep.
All right. So let's start with Ben. Do you got a question, Ben?
Well, sure. I think I'll stick with maybe some of the questions that you guys already came up with, and some of the candidates may have addressed them already. But just to give everyone the opportunity, I think I'd just like to hear some people's what their top priority is for the first 6 months of 2021, if they were to get voted onto the board.
Good question. Who wants to answer that? I see Eddie. So go for it. And then Catherine.
A self-sufficient, self-sustaining. Sorry. Can I go ahead?
Eddie, you start.
Answer?
Yes.
A self-sufficient, self-sustaining camp named Directions Home, so that they can acquire all the stuff they need there to get to a new place.
Great. Catherine and then Thomas.
That's it.
I'd like to, the first thing would be to look at the rules of the charter and delineate clearly the staff and board relationship so that the tasks are understood very clearly between the two.
Great. Thomas and then Don.
Great, thank you. I'd like to make sure we are looking at the data of our successes. I'd like to make sure that we broaden the spectrum of who we're helping and to bring, just get the numbers up so that we're not leaving as many people out, and deal with the safe parking and safe camping aspect that I believe that's incumbent on that in order to help more people at the same time. And it only uses a small amount of funds. So that's my answer.
Great. Don.
I think we need to immediately address some continuing governance issues. That includes continued restructuring of the board. It includes ensuring that the subject matter experts, including consumers, providers, veterans, healthcare providers, have a meaningful role as opposed to what's happened the last couple of years. I think we need to pursue, or at least explore in depth, the options for a lead agency, given the struggles we've had with CDC.
Thank you. So Colleen Halburn Wallace, do you have a question for the candidates? Is Colleen still here? I can't see everybody on my screen at the same time, so. Now it looks like maybe she is gone. So Don Sherman, you're next. Do you have a question?
Yeah, I think I'd like to hear what people think is some specifics about how to get the voice, the concerns of the people with lived experience incorporated, not just a seat on the board, but incorporated into the process and into the strategies and into decision making. I think it's something that we struggled with for a long time, and I think it needs a real focus, some focused strategy in and of itself. And I wonder if people have any thoughts about how to do that, get that that engagement from the consumers, so to speak.
Great. I think, Rick, you wanted to speak on the last question. Do you want to take this one? Start us. You're still muted, Rick. Let's see if we can get his, there we
How
go.
about now?
Yeah, that's good.
A big part of it is the way things are done. There's a body of knowledge about participatory decision making that would probably be more effective with the homeless people with homelessness and the history of homelessness than most others. And it's a skill set that has very definite ways of doing things and is effective in encouraging minority views to be expressed and heard.
Thank you. Who else? I see Gregory and then Chris.
Well, following up on what was just said, it needs assessment that's really coming from those who we're serving discerning what they need and what they perceive, how organizations that they're working with operate. It seems to be the most valid and the easiest to get. We don't often want their input. We don't often spend the time to get it, and we don't value it when it comes in. But it is the most important to getting good outcomes for them. So figuring out ways of getting need-based ideas from them and getting evaluations of our programs. We have lots of, the first 6 months, we're going to have decisions about major money, both still coming from the state and what we roll over. And we have no way of knowing how well any of those programs work. We're not evaluating them very well. We're hardly even reading the reports they send to us. So, I think coupling our own analysis and that coming from the user, from the client, seems to be the first priority and would be mine.
Great, Chris, and then Ben, and then we'll go on to a new question. I noticed that Catherine answered this question in the chat, and I would encourage any of the other candidates to do that as well. So go ahead, Chris.
Yeah, thank you, Adrian. Thanks for the question, Dan. I think it's a huge issue, and it also speaks to the second question, I believe, on the list. I don't have it in front of me. But I think that adding the input to the people living the lifestyle or people that have previously lived it is absolutely essential. That's kind of our model of the mission. That's how we get results, because I've been on a million collaboratives and a million groups in the community that have great stakeholders and great people and great ideas and great knowledge. However, if we don't know what they're going to be amenable to, we're always going to get resistance. And so you saw that under the bridge of the freeway, you saw 9th Street or 7th Street, and so on. So I think that it starts with finding out what they're going to be amenable to. You'd be surprised at the ideas that this population and people that have formerly had that lifestyle, including myself. I was homeless under the 3rd Street Bridge for 9 years. So I know how it can be when you have some input in it. So I think it might be another way of saying what everybody's already saying, but it's definitely a huge deal.
Thank you. And Ben, I'm sorry.
Yeah, I think it's a really important question, because I do think having those lived experience seats on the board is really important, and we do need those, but I think that's really just a first step. I know I've been on boards in the past that have had consumer seats, and sometimes those consumers, they feel like they're tokens, or they don't feel always empowered to speak up. So when I was working at Ritter Center, one thing we did is we started a community advisory board that was all consumers.
Yeah.
And I actually had the honor of facilitating that board. I have to say, I learned so much from that. I would try to bring agenda items just in case people didn't have things to talk about, but these folks had amazing ideas, both for how Ritter Center could help improve their services, but also just the general wider homeless services community, things that could be improved. And a lot of these things we were able to actually implement. And it was really just based on having a group of people come together in a space they felt comfortable and they felt they heard, and it was really all them. And it didn't have other outside people. And I think potentially having a community advisory board in addition to these seats on the board and actually bringing all the feedback from that community advisory board into the CoC board could be really helpful.
Thank you. Thank you, Ben. Elise, you have a question. And the next question will be from Jenny Lynn Holmes.
Yeah, so there's so many questions that come to mind. I think one of the, I like the attention to data, but I get concerned with data, and I think it was Rick who brought it up. If we have great data, but we don't have staff to actually implement and work with the providers who are doing some of the heavy lifting, it's very, very, you don't get anywhere. So what kind of staffing model would you recommend or look to build towards the future?
Great. Who wants to take that one on? Gregory, is there someone who hasn't talked yet? One of the other candidates. How about you, Gail?
You're muted.
You're still muted, Gail.
I think it's very important to take a look at what works and what works for similar areas and continuums of care. It's great if we know what San Francisco or Sacramento does, and that can inform us. However, we need to know more about things that happen in communities that are similar to us. And so that's one thing. I think another thing is that it's important for us to look at what the barriers are now and really work to deal with those barriers. I know I've heard over the years that people have case managers with maybe 2 or 3 or 4 different agencies. And how do they know which are the most important case manager to satisfy or the most important task to do? So there are things that I know are barriers, and I know that our people with lived experience can inform us about, where it just doesn't work now and that we need to make changes so that it does work.
Thank you. Who else wants to take a whack at this question? Is there anyone else who hasn't already spoken as a candidate?
Yeah, this is Sandra.
Please, Sandra, for it.
Yeah, I will say that analysis is important, but this cannot be an individual issue. This needs to be a team that will be analyzing this data, seeing the barriers, challenges, what actions to do in a way to be tracking the information. So you can work with many categories of variables, and so to do it more impartial. So this is why I think that this will be important to also consider a team that is, from different community providers, but also that include homeless. But I will say that it's important to include homeless that are bilinguals, that are Spanish speakers. So we can know the experience of life, and we can translate this information on the data that we will be having.
All right. So I have Gregory and Thomas. I think I'll pick on Gregory for this question, and Thomas, give you a chance to answer the next one.
Well, I was just going to bring people's attention to a thing called empowerment evaluation, which the philanthropic world has been working on. I was one of the leaders 30 years ago of it. Stanford University and bunches of others folks long ago said, the only way you're really going to improve performance of the contractor is to be a partner with the contractor. Right. And that means more than just responding to their, funding application. It means following them, allowing them to make changes, working with them, bringing partners together. We are partners. The philanthropic world knows the value of staff. It knows that staff shouldn't be to make a decision. It should be following up on those decisions to make it so people succeed.
Thank you. Jenny Lynn Holmes, you're next up if you have a question for the candidates.
I do have a question. Thanks, Adrienne. And thank you everyone for putting this on and giving us an opportunity in the short turnaround to learn a little bit more. I very much appreciate it. My question is, in the last, the time I've been in this position working on the board and in my job at Catholic Charities, we've kind of gone through 2 iterations of this governance body. The one that we're kind of reverting back to as a kind of way to move forward in compliance. And we also experienced what we've had for the last 2.5 years. So I'm interested in, from the candidates' perspectives, what they think a future model might look like, given the lessons learned, the successes and potential areas of growth between the 2 different models we've experienced here locally.
Okay, could you just say that in like one sentence?
Yeah.
I got a little lost.
What models?
Yeah, so we've kind of had the 2 models, right? There was the Continuum of Care board we had, which we're reverting back to right now as kind of restart. And then we've also have the home Sonoma County model we've had for the last couple of years. So I'm interested in hearing what candidates think the model should be moving forward, whether it's from what we've learned from these last 2 iterations of the governance body, or a different model they may have experienced somewhere else.
Got it. Thank you. So Thomas, do you want to take a start at this one? Or you could pass and we'll put you on another question.
Well, Jenny Lynn, it's a good question. And it's a complicated question, but the first thing is we know what happens if we're not in compliance with HUD. Okay, so we got to throw the baby out with the bath, and that's kind of an issue. So hopefully we can get everybody in alignment moving forward. I think that was what the goal was previously, and maybe this will be able to accomplish that at this time. So, but I really think that if we're solving the problem, then I think people get on board a little bit better. And where we were before, as I said, we were really only, sheltering and housing, just a real thin veneer. I think what has happened is an awareness that this is a huge problem, and dealing with the CARES Act money, and then I think it's the money for the hotels and motels to shelter people has really broadened the base of the number of people that are being helped. And I think that is at that level is what we have to look at, not at, moving the papers around or shuffling the chairs on the Titanic.
Got it. Thank you. So I have Don and Ben. Is there anyone who hasn't spoken, any one of the candidates who would like to take a chance at this, answer this question? All right, Don and then Ben. Oh,
Well-
Alice, I'll catch you in just a second. Sorry.
So we don't have, from the city perspective, a preset notion of exactly what the right solution is, but one that clearly has some things that have been missing from what we've experienced the last couple of years would be important. One is a meaningful role with their participants and subject matter experts, and that's probably a blend of being on the board and some kind of manageable advisory structure. What we've had, I think, was pretty clearly flawed from the start. And the second thing is the relationship between the board and the staff. That there's a sense that we have that there's a fundamental structural flaw when the head of the agency in charge of this is primarily reporting to the board of supervisors. And it's an inherent conflict there. And we need to create some solutions. Maybe it's a completely independent agency. That's been done other places that would solve it. But those are the kinds of things we need to fix. And I think there's actually some interim steps we can take to that. One, for example, is setting a protocol. This is standard in public administration and city management land. It's just the way you operate, for example. Any information that goes to any one board member goes to all board members at the exact same time. So it's transparent and everybody sees it. And frankly, I think we could extend that to include the membership and anybody else on the distribution list, because we need to build trust and transparency. And those are the kinds of steps we need to get there.
Thank you. Ben.
Yeah, I don't know if Alice has had a chance to answer a question. I'll be happy to let her go first if she would like to.
Why don't you go ahead just for my convenience, and then I'll get to Alice.
Okay. Well, I'd say, I noticed that we're reverting back to the previous sort of CoC board structure. And that was after the leadership council, which I think took a turn more to having more elected officials participating on the leadership council. And I really think it's just about balance. I really do think you need both. I do think you need elected officials at the table. I think it makes sense that happens in the old CoC board. I noticed that there's a couple of the medium-sized city trying to run for the at-large seats. I also noticed, like myself, there's a number of people from the healthcare for the homeless field that's also running for at-large seats. And so I think similar to looking at a board of directors for any nonprofit, you look at what are the needs for the board, what do we have, what do we need? What I see this time around anyway is maybe a need for a couple more seats for the medium-sized cities, as well as maybe a couple of seats for healthcare organizations that are serving the homeless as well. So the at-large seats can really go to really at-large folks. And you may get just a really interesting diversity of opinion of the people going for those at-large seats. And maybe those of us who are working in this field, whether it's in the public sphere or in the healthcare sphere, aren't all competing for these at-large seats. So I guess I just go back to balance and having that diversity of perspectives.
Thank you. And now Alice, and I do apologize for not seeing you. Just for everybody, it's the easiest thing for me is if you can use the little in the participants area to raise your hand with the little logo there. That's easiest for me to see, but I also will try to respond to hand waving and other things. Alice, go ahead.
Thank you, Adrian. And thanks to Jenny Lynn. This is a great question you asked. I think one of the great strengths and initially a real hope for people about the TAC was the diversity of roles that people were coming from on that board, and that it was on that committee, and it was such a large group of people. I would love to see a committee of everyone that is in this meeting right now. There would be an amazing committee, and we could have really good conversations. The frustration that I heard at the first Leadership Council meeting from somebody who works on the street, was working 20, 40 hours a week helping people outside, was how technical the meetings were, and at technical language, and completely blowing past the experiences of people with lived experience. The language and the conversations need to be down to earth, not a lot of technical alphabet soup of EFSG and so forth, different programs, so that people can relate to it and understand. It's not fair to people with lived experience to expect us to be in the weeds with all of the financials and technical things when we have extremely limited time, that we need to focus on recovering from homelessness, and we need to have down-to-earth conversations where we can talk about the problems that we're experiencing. I really think we need both a CoC that focuses on the financials and another meeting that's a standing meeting on a frequent basis to address and speak in the language of people with lived experience, that is accessible, that they can get to by bus or get to by Zoom, and that talks about, that centers our concerns rather than being about the concerns of other actors. Ask us if people want to know what we need, what barriers we're encountering in the shelter system or outside. Ask us. Nobody is even asking us. The feedback loops are almost entirely absent, except for a once a month survey at the living room, and I almost never was there the day they handed out the survey, and a survey at the end of my stay at COTS.
I gotta ask you to wrap it up.
Okay, thanks.
Yeah, I wanted to, because Alice hadn't spoken before, I wanted to give her a little more time on this. And all of us are getting more verbose. The questioners are getting more verbose, and the answerers are getting longer. So I really want to close this off in 10 minutes, and we have at least 3 people that I want to call on for questions. So appreciate everybody. Thomas, I'm going to ask you to answer the next question if you want. And just remind you that you can answer these questions in the chat. And those of you who are not able to ask questions, feel free to put more things in the chat, because we're all multitasking here. So Mary Haynes, do you have a question?
I do. Hi, everyone. Thank you so much for having this forum today. It's been really informative, and I just appreciate it so much. My question involves the coordinated entry system, and just knowing how many individuals are in that system, and knowing the lack of affordable housing that exists right now. How would you prioritize handling that crisis?
All right. Who would like to try that question? Thomas, I have you queued up if you're interested in this answer. Is there anyone else who would like to try this question? Yes, Ludmilla.
Come back to me because I'm doing something in the chat. I'm sorry.
I will. Go ahead, Ludmilla. Unmute. Yeah, there you go.
Hi, yes, I would like to work out that anybody who is in that coordinated entry system could have some kind of connection and some kind of access to services. Maybe having like a person, a terminal, you know, that they can.
Oh dear, she's
She
frozen.
froze.
Give her a few more minutes and see if her internet catches up. I'll just take this opportunity.
In Guerneville.
There we go. You froze for a little bit. Can you go back? And
Yes, I was going to say, in the coordinated entry system, I would like to know kind of how many people are waiting, and I would like to be able to work out some kind of something, some kind of connection, some kind of service, or something. At least having a person that person knows that they can go to see what the progress is on things, so they're not in mystery. And I have a close friend of mine has been on the streets in Guerneville in his car for a really long time. And I'm just going to throw this out there. I myself am currently unhoused. I have been on that waiting list since August myself, and do not yet have an assigned even safe parking spot for myself and my trailer. And I am on the sides of the road. I'm able to function that way, but it does take a lot of my resources to get through the day. And so, yeah, so I mean, this is a little silly. I'm sorry.
Thank you.
But it's painful because I know that others are much less connected than I am, and for them to not be able to connect, I would like to have that connection.
thank you. So I want to move on just really quickly because we're getting to the end of our time, and maybe we'll circle back around to this question. I know there's a couple more that want to answer it. But Tim hasn't been able to ask his question yet, and I know he's been waiting for a long time. So Tim, would you like to take a minute and ask your question?
Sure. You know, this is obviously the CoC takes on a community-wide effort, and to really move things forward, we need community buy-in. And as most community members spend a lot less time than we do on the issue, numbers are important. So I'd just like a few people to answer the question, other than in terms of metrics, other than the overall number of homeless dropping, hopefully year to year, what's the key metric that you would look at to measure success?
Great. And you're Tim Miller, I assume, right?
Correct.
Okay. So let's go to Thomas first, because you've also been waiting to answer. Then Stephen, if you want to take this question, then Eddie.
You know, Tim, I think that's a great question, and it's kind of hard. I think I understand your question is, other than the number of people who drop out of a program, you know, what is a key metric? And so I think we need to know that and have reports of those to where we can see that. But to me, a key metric is we have the count, you know, and if we're dealing with, say, if we're placing, say, 200 people a year into permanent supportive housing, and we're sheltering, say, 900 on and off periodically, we're leaving out roughly about 2,000 people, and they're there every night. This is what the information we have says. On the worst night. On the other nights, there could be more people. We don't know that. But certainly on the worst night in the winter, that's what we have. So I think we need to address that population. If we address that population and also think of a dynamic model, understanding the dynamics of how people move through the system, which is one of my expertise is looking at the dynamics of it and understanding where people move and how they move and also how they leave.
Thank you. Stephen Sotomayor.
Yeah, thank you very much. So to expand on that, when we look at, points of how do we measure success and how do we use data, in this day and age with the technology that we have, there's no reason why there shouldn't be a dashboard that's easily accessible to those that are part of the continuum of care, something that you can look up and take a look at the current figures and numbers with respect, of course, to HIPAA. We wouldn't go into that, but just to make sure that by numbers that we can all take a look at that. That's part of the transparency and part of the measurable successes. The other aspect is that the CoC board should really set milestones and goals that are available to the public so that people can look and we make a commitment to the dates that we're going to do things and when they're going to be done. And we can identify the funding that's going to go towards it. I think a lot of times we get pulled off, of course, like if you take a look at the Joe Rodota Trail, we shift a huge amount of resources, but we're not following a common vision in that process. And we need to have that common vision. But I think a dashboard, and then on top of that, I think when we talk a little bit about what success is, and we can't stop at just housing people, we need to look at the total recovery. We need to look at how we're working with them to address, issues that service providers provide, such as mental health, also trauma-informed care, to make sure that we're completing the circle of helping people out of homelessness so that they won't re-enter. And we need to make sure that we focus on that as well. So my data point is when somebody is successfully independently living or in a position where they're supported with the needs that they have addressed.
Thank you. Thank you. Eddie, and then Gail. And that'll
Yeah,
probably.
great question. Great question. And Stephen, that was a great ending where you went to, the final solution being that. I think we should be focusing on that right away. I mean, I think put all the resources right into permanent, a comprehensive, self-sustaining, program where people can get in, get the directions back home. And the bottom line, I think, to the question is the bottom line, which is what you ended the answer with, was, yeah, man, we got to stop facilitating and we got to start, housing people instead of facilitating people in different camps. And it's got to be at focus on a self-sustaining permanent solution for this situation. Thank you. And I'm humbled to answer these questions. Really, I don't,
Yeah,
but-
Gail, and then Ben, and then I think we'll let everybody take a break and have an afternoon. Gail, are you there? There you go.
Still not
Gail's
muted.
muted.
Oh, yeah. Gail, you're muted.
Trying to do that.
There we go.
Okay, in answer to Tim's question about not counting, looking at results other than just the number of people housed, I think it would be easy in the coordinated entry to ask each applicant what is their goal in addition to being housed? What else do they want to accomplish? And see if we can't do instead of a linear referral system, maybe a net referral system where some people maybe want to get a job and some people maybe want to get help with alcohol or drugs, or some people want to get help with mental issues or getting their record expunged. We need to have more goals to look at from the people who aren't housed themselves and try to work towards their goals as well as the community goals.
Thank you. Ben.
Yeah, I mean, I'd say obviously there's really no one metric I think that you can use to gauge success, but I think given the amazing, drastic affordable housing shortage in our community, that the number of new permanent supportive housing units we're able to bring online is the most important thing that we can look at right now. And how do we retain people in those units? And that's obviously through the services that we provide. It's called permanent supportive housing for a reason, and that's because of all the supports that go along with it. And one thing we did in Marin County is that we were able to work closely with our housing authority to get vouchers for specific programs.
Yeah.
So we worked with the whole person care with the housing authority to get 50 Section 8 vouchers. So we're not just coordinating services with people, getting them into housing and then providing those services to them in their housing. Same with the serial inebriate program. The housing authority put up 50 shelter plus care vouchers so that we could actually work with folks who are having issues chronically getting arrested by the police department for being intoxicated in public, getting them housed and providing service to them in the housing to make sure they retain their housing. So to me, it's the number of new PSH units, and we can't always be converting a motel into a permanent site. Some of it has to be scattered site using vouchers, because it can take years to get those types of motels online. They're very important, but it's just one strategy in the toolbox.
Thank you. So we're a minute over my planned ending time, but Teddy has a couple questions, and I'd like her to have some answers. Maybe if you just pick one, Teddy, and I ask all the rest of you could just stick around for another 5 minutes. Let's try one more.
Thank you, Adrian. You know, those of you who know me well know that capacity building is a concept that I feel really underlies the basis of success, however that gets defined. And on this call, even, there are those of us who work in this work and they know the terminology and they understand the conceptual stuff very clearly. There are other people who will be coming on our board who don't know and don't have this literacy. So what I'd like people to offer to weigh in on is, how do you see building that internal knowledge for the strongest decision making for the folks that don't do this work every day with the acronyms and the finances and the HUD overlay?
So how do we keep it down to earth, but have a constant process of education and all of the intricacies? Gregory, I'll start with you.
Well, obviously, a lot of us are spending time on Zooms or webinars or videos that are being created around the state by CoCs. As most of you know, I'm also trying to connect Sonoma to the rest of the world, and certainly to California. And so perhaps getting some of the best advice, the best practices, in 10-minute videos or something that, allows everyone, not only just those on the board, but everybody else, to learn what we think works and how it works best as a CoC. I mean, we have to reach out. We have to learn, not only the people who understand it all, Teddy, but everybody else who's just following us in that progression of understanding. So I would vote for a lot more videos. We all have a little more time, and for 2 o'clock in the morning. I mean, we've got something that we can learn about. And so we need to have some people developing those videos. You're doing a good job, and I appreciate that. But we need a lot more of you, and we need a lot more money from our own sources to be able to train ourselves.
Thank you. Ludmilla and then Rick.
Yeah, I just wanted to help facilitate a forum where people could have access and that would actually work as like the homeless, currently homeless, the people that have lived experience that that are coming forward here. Also, we would practice. We would get more practice in coming up to speed in Zoom. It's like that, kind of in that other meeting that we'd have, and that would help bring people up. It's actually an essential job skill at this point in time too. So it would help bring people up in their life skills. Thank you.
Thank you. Rick?
In terms of the question is really very applicable on a personal basis for each one of us that are in that group. Maybe for each one of us, and especially those of us in that group who are not as familiar with the acronyms and the specifics as others, and also for the entirety of the group. And Gregory had addressed that with the idea of the value of a variety of brief videos talking about some of these issues. The idea of having some subgroups, and particularly subgroups of folks who are newer to some of this work, to meet together and review things in addition to the individual homework that each of us will be doing, would be a great addition.
Thank you. Alice, I hear you saying you've been raising your hand. Is that true here?
Yes.
Oh, I'm sorry. I don't see your hand raised for some reason, and I apologize. Do you want to speak to this?
Thank you. It turns off after a couple of seconds, so it's hard to see. So I'm not sure if this is quite addressing Teddy's question, but it's addressing several questions. And do you mind, because Tim's question is sort of related, Teddy, would it be okay if I address that because it has to do with data?
Yeah, sure.
Okay, thank you. So Tim asked a great question, and there is a lot of talk about the value of data, and I believe in that. And Teddy has really educated me on this. And at the same time, I agree with Ben that not everything can be captured by data, particularly if the questions aren't being asked.
Right.
And you're aware of this, Teddy,
Oh, yeah.
the value of talking to people and listening to people about their experiences. And so I just want to caution on the data, looking at a particular metric. And the metrics that I would advocate for are what Thomas said, which is focusing on the number of people outside. And I love that dashboard idea of having that on the dashboard at all times. And second is there's no data collection of how people are landing outside. And a key way is that people are getting kicked out of shelters or they're timing out without getting the help that we need to get out of shelters. I spent almost 2 years in shelters begging for a desk at which I could get my work done. People think, oh, the library's fine. No, it's not. You cannot get your work done there. And very few people are able to do that. And I talked with probably hundreds of people on this topic who were expressing the same sort of barrier and frustration. And they time out of shelters and end up on the street. This is a life or death situation. It's an infrastructure problem. And it's an example of what isn't being asked in the surveys. And so we just have to have conversations.
Thank you.
In order to get at some of these issues. Thanks.
And Thomas, I see your hand, but I think I'm going to ignore it and move to close the meeting and let everyone go back to their day. I just want to say again, this gives me great confidence in our community and the ability to do the work we need to do. There's obviously tons of talent, skills, good ideas, amazing people here. And so the main issue is how can we make it happen in the more formal process that we have to go through to do the Continuum of Care Board. And I trust some of you will be thinking about that going forward. You're all welcome to come to Homeless Action meetings every Monday morning. We do go over some of this stuff in depth, so it's a learning experience. Certainly it is for me. And, we'd love to have you help there. And that's all.
Yeah.
Adrian,
I just want to make sure that if it was spotty getting to everybody's contact information. So if we don't have your email, like Rick, you were a toughie to find for me. I had to trace you through Facebook. If you would make sure Adrian's got your email, just drop it into the chat here. And the other thing too is like the quality of what I've heard today is really so strong. And I have, there are only so many board seats, but I hear a lot of commitment to really restructure the subcommittees for impact is the way I will put that. So thank everybody so much for all of this great interaction.
Yeah, and please do leave us your email. I will send everybody the main points of the chat, all the good ideas, and clean it up a little bit so it's easy to read. So if you are not on my email list or got here from some other way, please send me your email right now so that I can give you the feedback and give you what we created here today.
And then Adrian, can we put your email up in the chat? Sonic.net?
Yes, of
Adrian
course.
at sonic.net.
That's right. Yeah. Okay, any other little housekeeping thing? Thank you all. Thanks for everybody, especially for utilizing the chat and being so patient and kind in the way you responded, and such good listeners, such good listener witnesses.